Hello, everyone. I'm Dr. Koj with the Koj Wellness, and welcome to another podcast slash live stream. We are going to talk about, we're going to be talking about today a really, really popular class of medications, the GLP-1s, um, commonly known as Ozempic or Wegovy or Zepbound or Mounjaro or tirzepatide or semaglutide. All of these are synonyms for that once weekly injection that's causing everyone to lose weight. Celebrities are on it, your friends are on it, you might be on it. Um, everybody's on it. So we're going to talk about a few things today. We're going to talk about the mechanism of action, so basically how it works. We're going to talk about some side effects. We're going to talk about what it's used for. We can say the why, and we'll talk about some studies that have been done for it. All right. So let's talk about well, first of all, let's talk about the drug period. So the class of drug is called GLP-1, glucagon-like peptide 1. It's a peptide. Your body produces it naturally, actually, from the GI tract or from your digestive system, we could say. And it's pretty short lived. So it's half life, meaning half of this peptide is gone in about 2 to 3 minutes naturally. But when it's produced and manufactured, the half life can extend for several hours. So what it does, the positive effects of this can last way longer than it naturally does in the body. Okay. So let's talk about how it works, mechanism of action. So again, your body produces this naturally, but when you take the synthetic form, it does the same thing, but just lasts longer. So it increases insulin. And as we know, insulin is the hormone that your pancreas produces to take sugar out of the blood. And you may have heard that this type of medication was originally designed for diabetics, type 2 diabetics, because they have high blood sugar. So if you can produce a hormone that takes sugar out of the blood, then it can decrease your blood sugar and it can decrease the negative effects of diabetes. So that's one of the mechanisms. It increases insulin. It decreases or slows down gastric emptying or your stomach emptying. Essentially, it takes longer for you to pass food through your digestive system. We know that your basically your digestive system is a tube from here, goes through the whole thing, and then comes out the back end, that really long tube. So this medication slows that entire process down. So broadly speaking, if it takes 4 hours to digest a plate of food, it'll slow it down. It could be 5, 6, 7, 8, 10 hours. And because the food is taking longer to pass through your system, you're going to have an increase or a more steady feeling of fullness. You're going to feel fuller longer. Oops, let's not do that. You're going to feel fuller longer. So you're going to feel fuller longer. You're going to get some increase in insulin. And there's hormones that are produced in your GI tract that send signals to your brain that tell you, hey, there's still some food here. So we get what we call a decrease in food noise. You're not going to be thinking about food as much if there's constantly food trying to be digested in your GI tract. So this is basically how this works. And then when we add all of this up, it's equal to eating less. I'm going to eat less food if food is still there. I'm going to eat less food if I have decreased food noise. I'm going to eat less food if I still feel like food is passing through my system. And then when you eat less, that's equal to weight loss. Broadly speaking, this is how this works. It's a once weekly injection. It's really simple. That's another reason why this medication is so popular. It's really simple, once weekly medication, and you have all of these effects. This particular peptide, the synthetic version of this peptide, lasts a really long time compared to what it is naturally, and you're going to feel fuller longer. You're going to feel less hungry. You're going to get less food noise. You're going to eat less, and then you'll lose weight. This is essentially how this works. Okay, so those are all the positive things. Now, let's dig into some of the side effects. Give myself some more room there. So, as you might be able to guess, if food is taking longer to pass from the tube that starts here and ends here, we can have some potential side effects. One of them could be heartburn. Makes sense. If it's taking longer for food to pass from here to here, the food can get stuck there and you could feel heartburn. And if it goes down, the GI tract, you can get constipation. Makes a lot of sense. If food is taking a really long time to pass through, people can feel constipated. Another side effect is fatigue. That also makes a lot of sense because I'm eating less, I'm having less calories, and so I might feel fatigued because I'm still doing my typical normal activities of daily living, driving, exercising, walking up and down stairs, going to and from work, visiting friends, all of that type of stuff. But because I'm eating less food, I have less calories. Fatigue is a possible side effect. And then another one, we have nausea/vomiting. This is one that we commonly see, but we see it kind of increased when people eat particular types of foods. So, greasy foods, fatty foods, the more unhealthy type foods. This seems to increase nausea and vomiting. And this is something that we see with our patients a lot of times too. Foods that are very taxing on the liver, we could say. So greasy foods, fatty foods, oily foods, and alcohol. I've had several patients who say, they have one to two glasses of wine per night, but when they get on the GLP-1s, they either cut that in half or they don't even have a taste for it at all. Also, overeating can cause the nausea and vomiting because when you get on the medication, it takes a little while for your brain to catch up. So usually I have a whole plate of food and I've been on the medication for 2 weeks and I'm gonna go eat that normal whole plate of food. But when I get halfway through it, I start to have some nausea vomiting because again, the food noise and the gastric emptying is slowed down and you're just getting signals from your GI tract to your brain to be like, hey, slow down. Like we're not done processing all this stuff. So of course, people it takes a little bit of time for them to get used to, hey, I can't eat like how I used to. And so some side effects can pop up that way. Okay. So now let's go on to the why. Give myself some more room there. Let's go on to the why. So, originally, this medication was used for diabetes, type 2 diabetes. And as we know, type 2 diabetes is an increase in blood sugar. So, as we talked about previously from the mechanism of action, the increase in insulin causes a decrease in blood sugar, and it was used for type 2 diabetes. In larger doses, it was found that it had all of these positive effects, so it was used for weight loss. So now let's get into a little bit of nomenclature here. So when you see the medication called Ozempic, that is the GLP-1 when it's being prescribed for diabetes. When you see the term Wegovy, it's the GLP-1 when it's being prescribed for weight loss. The medication is the same, the active ingredient is the same, but the intention is a little bit different. So people can say, oh, people say I'm on Ozempic, I'm on Wegovy, I'm on semaglutide, which is the active ingredient. Um, but basically, it's the same thing, it's just a brand name, and so just don't get too caught up on that part. Now we can go into some studies because people ask this question a lot. This medication is great. I'm not having that many side effects. I'm losing weight. People around me are losing weight. But what happens when I get off of it? So there are a group of studies called the STEP studies. Okay, and I believe they're on step 5 now. So at every step, they're looking at what is happening to these folks on this medication. So in the step 5 study, people were on this medication for about 2 years, 104 weeks, 104 weeks. And they lost, I want to say about 15 to 20% of their body weight during this. Once they got off, and you'll see this in all the commercials too, once they got off, they put on a significant amount of their weight back. So what these studies are concluding is that the the positive weight loss, gastric emptying, decrease in food noise, increase in insulin, the positive effects of these medications, they're only maintained while you're on the medication. So people were on the maximum dose for 2 years, they lost X amount of weight, but when they got off and they were looked at after that, a significant amount of them put the weight back on. So in naturopathic medicine, we call this kind of like a band-aid, right? We call this is a branch medication. It's not getting to the root cause. But sometimes we can use branch medicine as a way to get down to the root. Right? So I tell my patients this all the time. You're on this medication. You have a decrease in appetite. Your food noise is down. You're losing the weight. And then they ask, what happens when I get off? Well, your hunger is going to increase. You're going to feel hungry again. Those things that you lost the taste for, they might actually come back. But the beauty about this medication is when dosed properly, when used properly, you can actually use this as a springboard because while you're losing the weight, there's several things that you can do. And this is where the naturopath in me comes out. So we can be more cognizant or aware of our dietary intake. This medication forces you to do that because typically you're not going to be able to eat as much greasy, fatty foods. You're typically not going to be able to um, drink as much alcohol. So that's automatically built into taking this medication. The second thing is you're going to probably increase your fiber and your water intake because one of the main side effects, as we spoke about, is constipation. And how do we combat constipation? By increasing fiber, increasing water, and also increasing exercise, increasing physical activity, getting everything moving, getting peristalsis going. Another thing is physical activity or exercise can be its own category because this is a key point that I want to point out. Oftentimes people get on this medication and they lose weight very quickly, but we know that muscle weighs more than fat. So people say, oh, I've been on this medication for a month. I lost 25 pounds. It's great. But did we lose muscle or did we lose fat? So when people tend to lose weight really, really rapidly, it may be that they're losing muscle really quickly because they're eating less food and the body's like, hey, I don't have as much glucose and I don't have as much fat to burn, so I got to start pulling from that muscle. So if you don't want that to happen, then you're going to implement physical activity and exercise, more especially resistance training. So that's lifting weights, doing calisthenics, doing band work, doing resistance training, isometric work, isotonic work. All of that's really good. So, so these are ways that we can get down to the root. So if you're on this medication, which is branch medicine, that's the GLP-1, while you're on it, you can be working on some of the roots, which is being aware of your diet, increasing your fiber, increasing your water, increasing your physical activity. Another step here is getting a DEXA scan. So a DEXA scan is the most accurate way to measure your bone density. So I always suggest to my patients before, during, and after getting on the GLP-1 to get a DEXA scan because it can properly track. You lost 20 pounds, but how much of that was muscle? How much of that was fat? If you get a DEXA scan and you get a DEXA reading before you start, you can actually track, okay, I've lost 20 pounds, but 5 of that was muscle and 15 of that was fat. So another very important thing is to get a DEXA scan before, during, and after to see where is the weight actually coming from. And lastly, you're going to pay attention to body composition because some patients, some clients, they'll come in and the scale won't necessarily change, but they'll notice, hey, I'm down a dress size, or I used to be a 42 waist, now I'm a 38 waist, but their weight might not change. So while you're on this medication, of course you're going to be paying attention to your body more. You're going to have increased body awareness, and this is part of the root. This is part of the root medicine that we're talking about. So we're not just looking at the scale, looking at the scale, looking at the scale. Maybe the scale doesn't change, but you notice that your clothes are fitting differently, your confidence is increasing, your body composition starts to look different. These are some of the things that you can pay attention to while you're on this type of medicine, because you don't want to be on this medication forever. You're not going to be on this medication forever. But if you're on it, these are some of the things you can highlight. So when we're dealing with this root medicine here, not only does it increase your body awareness, not only does it mitigate and decrease side effects, but it also allows you to see how this medication is actually working in your body. Are you losing muscle or are you losing fat? So overall, it's a very positive medication. We're seeing a lot of positive things in regard to weight loss and body composition, but now there's been some very small studies that have shown at lower doses, we're seeing lower doses of this medication, of course, in animal studies, aka rats, mice, always abusing the mice. At lower doses, we're seeing a decrease in inflammatory markers, in the central nervous system. So some clinics, some doctors are using these GLP medications in smaller doses for inflammatory conditions such as MS, such as lupus, such as rheumatoid arthritis, these autoimmune conditions that cause inflammation. At lower doses, there have been some small positive studies showing that these GLP-1 medications are effective for that. So I'm predicting that in the future we're going to start to see this even being used for other things besides weight loss. Recently, it's been FDA approved for those who have increased risk of cardiovascular disease. So now, possibly, if you have an increased risk of heart disease, FDA approved for that. It's been FDA approved for sleep apnea as well. Of course, it's been FDA approved for diabetes type 2. And I'm pretty sure soon enough we're going to see at lower doses this being approved for other things. So it's a very, very positive drug. Now, quickly before we end, I want to talk about another drug that's come out that's even probably more popular. It is called Mounjaro. Get into some nomenclature here, or Zepbound. Zepbound. And the active ingredient in this is terzepatide. All of this falls into the class of drugs GLP-1 plus a GIP. So if the GLP-1s, the semaglutides, the Wegovy's, um, the Ozempics, if all of that is Batman, think of Mounjaro and Zepbound and terzepatide. Think of that as Batman and Robin. By the way, when it's Mounjaro, it's for weight loss. When it's Zepbound, it's for diabetes. Diabetes. And terzepatide is the active ingredient. Just so we understand what we're talking about when we say things. So it's the GLP-1, everything we talked about before, plus GIP, which stands for glucagon inhibitory peptide. So we get all the positive effects. We actually get more of an increase in insulin. We get a decrease in gastric emptying. So we get that. We get a decrease in that food noise. But why this is so popular is because we also get a decrease in the side effects. When the GLP-1 is combined with the GIP, we get a decrease in those side effects of nausea, of vomiting, and of fatigue. So that's why the Mounjaro is really, really popular, and it's getting more popular. So broadly speaking, I would give this drug. I would give this drug when dosed properly, when when used properly, I would give it an A. Um, yeah, you know, we're dealing with weight loss here, so a lot of people are using it to lose that 5 and 10 pounds. Ooh, another great point. Before we wrap it up, another great point. We often hear that people are having these really, really strong side effects: the stomach paralysis, the really strong GI pain, the pancreatitis when they're using these medications. But all the studies done, let me just give a quick breakdown here. So we can say for the Wegovy and for the Mounjaro. Okay. Both of these have maximum doses. So the max dose for Wegovy is 2.4 milligrams. The max dose for Mounjaro is 15 milligrams. Okay. All the studies done on these medications, those studies that we talked about before when people lost weight and they gained it back, those were done on a particular population, on the obese, on the overweight, and folks with diabetes. But as we know, a large majority of people who use these medications, they might not be obese, they might not be overweight, they might not have diabetes, but they're following the dosing schedule, this max dosing schedule of people who are morbidly obese or morbidly obese diabetics. So I would posit that some of the side effects that we're seeing, some of the really harmful side effects that we're seeing, or some of the persistent, consistent side effects that we're seeing, is because people who are not morbidly obese diabetics are dosing as such. So that's why it's important that you connect with your doctor and you dose and you titrate up accordingly. It's like certain medications, you take a certain amount if you're a certain weight. So If I'm weighing 100 pounds, but this medication was uh, studied and prescribed and created for somebody that was 300 pounds, and I'm taking the same amount as a 100-pound person, I might get more side effects. I might get more side effects more severely, more rapidly, more frequently. So this is always a point that I wanted to bring home, that oftentimes the side effects that we see in people who are not suffering from these conditions, they could literally just be because you're taking too much of the medication. And the studies that were done were not for the population that you're in, but for a more sick population or a more fat or overweight population. Okay, so that kind of wraps it up, guys. If you have any questions, feel free to put them down in the chat. Be on the lookout for more videos. If there's anything in particular that you want me to speak about, we can add that, like, share, subscribe. I'm also going to put this on our Spotify channel, and you can find us at Okoje Wellness on all streaming platforms. Thanks a lot. See you next time.